So in this video today, we're going to be discussing what meth withdrawal is really like in the psychiatric setting and what to expect if going to detox. This is from the perspective of a psychiatric RN that works in a mental health hospital, but also a lot of these things I'll be telling you are symptom side effects of patients, but also what patients report to me in general. I mean, what they report to the RNs, to anyone, what the most common side effects can be of meth withdrawal, or even why it is so hard to quit methamphetamine. Let's jump right on into it. Please like and subscribe. Leave a comment if you want. Let's get in. So the first thing you might expect if detoxing off of methamphetamine, and this goes in the psychiatric setting or even in the outpatient, or not even the outpatient, but just in the real life setting, just daily, if you can't detox in the psych setting, is sleep. So this is universal, one of the most universal things you will expect when detoxing off of methamphetamine. Now with this, keep in mind, the reason being, it's because methamphetamine is obviously a stimulant. And with this, there are times where people don't sleep for weeks. They stay up. Now, once again, weeks can be, people can say, oh, I haven't slept in weeks. That might be true, but little bouts of sleep, they might not have realized, but they probably have gotten, because if you haven't slept in 2 weeks, the torture you can go through with this. And this might be as well one of the reasons why, when you're lacking sleep, why psychosis can be common. Now, number 2, hunger. Now, from a patient in the psych setting, this was 3-4 years ago, I believe. One thing that multiple patients had reported, and this was more specific among females in particular, is the hunger aspect because of weight gain. So a lot of times when people are using things such as stimulants, methamphetamines, etc., and they're using it, and once again, methamphetamine in specific, but even medications that are stimulants, if they're not using it the right way, your hunger is suppressed. So when you are getting off of it and detoxing, you're, after sleeping for sometimes a couple days straight, hunger is something that comes back. And with hunger comes back weight gain, which some people, once again, I've run into a lot of patients who actually as well suffer from anorexia or bulimia because of the drastic weight changes. And when somebody's been using, keep in mind, methamphetamine for years, their perspective of how they look it's deceived to an extent, because once they're off of it, a lot of times patients can't accept, or people can't accept, the fact of weight gain. So hunger is another thing to expect. But with this, more times with females in particular, eating disorders can sometimes happen. Not saying it doesn't happen with men, but I can personally tell you that what I've seen is typically it happens more so in women. Now the next part I want to briefly touch into is number 3, and this isn't what to expect. So I don't want this would maybe be a reason sometimes people wouldn't actually stop using, is the potential for psychosis. So surprisingly, there are functional methamphetamine users out there who actually hold down jobs and stuff, which sounds insane, but once again, it happens. But for the ones in particular who are shooting up, highest chance of developing psychosis, unless you potentially do have a history of mental illness in your family, that can heighten the chance as well. I talked in a video about this a while back. But yes, psychosis is scary. It can be very scary. From what I've seen from patients, or even what patients have reported, and as a result, sometimes have to be on antipsychotics from now on. And once again, this isn't something that happens a lot, but in particular for people, I should probably preface this with, who have been shooting meth, have been shooting it. the chances of developing psychosis are a lot higher. And I've had a lot of patients who using methamphetamine long term, family history, and shooting up. Typically, more times than none, an antipsychotic medication might be used. And antipsychotics do have side effects, just like anything has side effects. But I will say that antipsychotics, at least, the thing I will say about them is it really can help somebody that is in active psychosis, like olanzapine, Zyprexa, an IM of that to help them sleep, but also help with the potential of developing even psychosis. Sometimes Zyprexa can really help in that aspect. But I will say, once again, shooting up methamphetamine, there is a higher chance of developing psychosis with this. And this can come, but you might say, let me back this up. You might say, though, psychosis is brought on due to methamphetamine use. That is true. But once again, some people who've been shooting for years, because remember, overdosing on methamphetamine, when it comes in the aspect of just methamphetamine alone and overdosing resulting in death, very low. But a lot of times polysubstance abuse can be common. But post-use, not even post-use, but once again, if somebody's actively using methamphetamine, yes, from lack of sleep, family history, yes, you can develop. That can happen. You can develop psychosis, but more times than none, a lot sometimes after in particular shooting up use. I've seen it sometimes, but it's very rare in somebody who's not been shooting up, just smoking it. But psychosis is something that's common. I know I went on a little tangent right there, but what I've seen, at least, post-use psychosis, higher chance. And that's not to scare anyone talking about psychosis, but it is really one thing to keep in mind in general. And lastly, mental cravings. Now, the mental cravings are a lot of times what makes it so hard for somebody to stay clean off of methamphetamine long term. And this can go not just with methamphetamine, this can go with any substance, because of PAWS, which is post-acute withdrawal syndrome or symptoms. A lot of times you might hear it with opiates and opioids. That's where it's used a lot, but I think it can be applied, though, as well to other substances, just in the idea of, it's not the same thing, but in the idea of a lot of times those mental cravings and that withdrawal that happens when you go past the physical withdrawal aspect, typically those cravings are what make it the hardest. And I can even tell you this, I've had one of the number one things I'll tell you that patients report on why it is hard to stay clean long term is not the physical withdrawal symptoms. Now, with some other substances like Suboxone, things like this, because of how it can get into your bones essentially, so you release it over a longer amount of time, that's different. But I'm talking methamphetamine. The physical withdrawal can be tough because your body, once again, it's trying to balance back into homeostasis. So, yes, you can have nausea, vomiting, physical symptoms, but a lot of times it's not that. It's, yes, sleep, coming down off it, not actually, not feeling that upper feeling or whatnot is hard. It can be hard, but it's wanting to use, it's coming back to it. So those mental cravings are, in my opinion, and what, once again, patients have stated and whatnot, is the post-acute withdrawal of the detox. And this goes with, once again, lots of substances. And I'm not saying the physical withdrawal is tough, but I can tell you that 9 times out of 10, somebody detoxing, if they said, give me the physical withdrawal symptoms, if this means I don't have to go through the post-acute symptoms or just the cravings of it, guarantee you they would say this: give me the physical symptoms any day. If it's flu-like for a couple days, a week, heck, even 2 weeks, I still think a lot of times people would pick that and then just feeling normal again and avoiding those mental cravings. This is a random video, I know, but I really wanted to hit on this because it's something I've been thinking about a lot lately, just in general. being this time of the year, a lot of times for people who are suffering and are addicts, the winter can be really hard. I know a lot of places are getting hit pretty hard. I've been in really bad temperatures recently, but I just want to let everyone know out there that this is for educational purposes, and this is just to help someone. If anyone, if honestly, I wouldn't even care if it just got one view. If it helped one person out there and helped them become a better person, or they learned something out of it that they used and helped someone else, I'm happy for. I greatly appreciate all these all the new subscribers. It's amazing. Keep sharing the word. Check out my 365 days of running. I'm going to be doing once again a methamphetamine history video soon. I'm still working on that. There's just some stuff I still need to retouch on. And also with that, I'm going to be doing the ghost story series soon. So like and subscribe. All things mental health here, all things running. I run every day 3 miles as well. That's part of the 365 days of running. So that's why you see YouTube shorts every once in a while. But like, subscribe, leave a comment, and as well, hit the notifications. I'm out. I love you all. Have a great night, and just kick butt every day.